Hello, and welcome to Jersey Matters. I'm Larry Menti. On this week's show, we're going to spend the first half hour covering the second surge of the pandemic in New Jersey, and then light at the end of the tunnel as thousands in New Jersey are now getting the new COVID-19 vaccine. We'll start with the man in charge of keeping track of the winter surge. Sean Hopkins sees a silver lining in the numbers so far. More good news. The first COVID-19 vaccine is given in New Jersey to a very happy healthcare worker at University Hospital in Newark. But the real work of distributing the vaccine is still ahead. We'll talk with the man in charge at University Hospital, Dr. Sharif Elnahal, about logistics. We'll also check in with Hackensack Meridian Health and their plans to vaccinate thousands. And is it poinsettia or poinsettia? We asked the man in charge at one of New Jersey's largest commercial nurseries. We have a packed show for you today, and we begin with Sean Hopkins, who is Senior Vice President at the New Jersey Hospital Association's Center for Health Analytics Research and Transformation, also called CHART. Sean, thanks so much for doing this. We really appreciate your time. I know that during the pandemic, analytics has been key to find out where to send resources, to find out if treatments have been working. Since this has started, you've been doing analytics on New Jersey. Can you tell us what you found?
Well, we actually just released a study within the last week or so that looked at the relationship of chronic conditions and how it interwoven with COVID, what the impact is on a patient's stay. We also looked within the body of that study at what I like to refer to as the peak of activity, which was the beginning of April or middle of April, through the trough, which was the summer, and now what we're seeing in terms of heading into the fall surge and some of the changes that have occurred in hospitalizations.
What are some of the key changes? What jumped out at you?
Well, some of the things that we saw is that back in April, so when the first COVID case that landed at a hospital was on March 4th. 6 weeks later, we had 8,200 patients in hospital beds that were COVID positive or persons under investigation, assumed to be positive for COVID. That's a pretty big leap in a very short period of time. At the time, in excess of 30% of those patients were on ventilators. The average length of stay was 9.5 days, and the mortality rate for patients that were in the hospital back in April, 25%. One out of four patients admitted to the hospital in April ended in a mortality. So that's very, very stark imagery, so to speak. We scroll all the way forward to where we are now, and we're looking at the length of stay dropping from 9.5 days to 6 days. We're looking at the mortality rate down around 6%. And we're looking at the number of patients that are requiring ventilation dropping from in excess of 30% to approximately 10%. So in the beginning, hospitals really had no playbook, but now they have learned from their experience and are more effective and efficient in their treatment of the COVID patients. We're also seeing a little bit of a change in the demographic. Back in the beginning, back in April, a third of the patients admitted to hospitals were 60 years old or older. And only 3% were between 18 and 29. We scroll forward and we get into the late summer, and about 22% of the patients being admitted now are 60 years old or older. And we're up to about 13% of the population of the patients that are between 18 and 29. So we're seeing a little bit of a shift in the demographic as well.
I want to leave your report for a second and just add, do you do daily numbers? Do you keep getting information in on a daily basis?
We do.
So do you know at this point what the fall surge is like?
Absolutely. Yesterday, which would be December 14th, we saw 3,660 patients in a hospital bed. So that's up from about 400 to 450 in July or August, what I call the summer trough. But now we're into the winter surge. Now, the good news is that within, obviously, the immediacy of the fact that the vaccine is now kind of on its way and already beginning to be deployed to healthcare workers. And it's probably going to be a matter of months before we continue to see widespread distribution of the vaccine, but there is a light at the end of the tunnel.
Yeah, but before that light, there might come a peak. We heard Dr. Fauci say that at mid-January, he's looking at a peak. If these numbers keep increasing through December into January, when is that a crisis for the hospital system?
Well, the one thing I will say about the hospitals is that when we were back in the spring, back in April, when the surge hit, and it says 6 weeks from case number 1 to case 8,200, the hospitals were looking for everything they could do to get their hands on more ventilators, to make sure that they had enough PPE, personal protective equipment, to treat those patients. And ultimately, they also continued to look for different and unique ways to expand capacity, taking a gymnasium, taking a cafeteria, and converting them into ICU bed stations where they could add additional capacity. So to answer your question, when will we hit that where we're on the ledge of that breaking point again? It's hard to say, but I would imagine that after the holiday season, within a matter of weeks after that, we would probably start to see the peak of the second surge. But I would say that due to the lower lengths of stay, the fact that the hospitals have a better handle around how to treat the patients efficiently and effectively, and the fact that they have already ramped up previously unused clinical space to be able to surge up and hold more patients, I think we're much more prepared in January and February than we were in April to deal with a second peak.
One thing they talk about all the time is how ICU units are filling up. When they have these extra areas to take people, are they for intensive care as well?
They can be, if they establish the beds as ICU beds and they have the appropriate equipment and staffing to accompany those additional ICU beds, then yes, they can put patients in there. We were in a situation in the fall where ICU capacity in some instances and vent utilization in some instances at some facilities was capped out. No more ICU bed space, no more vents available at facility A. We're seeing much less of that now as we kind of scroll forward again, because again, as I said, hospitals, they've gotten their hands on additional vents to be utilized. And as I continue to say, they've reduced length of stay and become more effective in their treatment of the patients. And so from that perspective, I would like to think that the secondary surge will not be identical visually to what we saw in April.
And you're looking at the daily numbers, so you're looking at them with some confidence. It keeps going up, though, right? Where are we headed?
Yes, the numbers are continuing to go up, but interestingly, we thought that there would be a significant surge after the Thanksgiving holiday. Much as we saw there was a surge after some of the summer holidays. We thought we might see a significant surge. In April, we saw it was almost like an inverted V, where you started out at 0 and then it just kind of climbed significantly until it hit that 8,200 case peak. What we're seeing now in the fall is we're seeing incremental steps upward. So today, maybe 20 patients more in total than yesterday, and 25 that yesterday more than the day before. So it's growing, but it's growing incrementally. But I think that it's going to continue to grow, and that incremental curve may actually accelerate because of some of the things we talked about, like the holiday season.
But nowhere near beyond capacity at this point. You're not forecasting that at all.
I would like to think that is not going to ultimately be the case, because the hospitals do have the ability to surge up. If you remember, in the fall, there were field medical stations that were established, one in the north, one in the central, and one in the southern part of the state. They were utilized to some extent, but then ultimately closed down. And the hospitals, as I said, they were very, very creative in terms of converting unused space into additional capacity. So that is, to be able to ramp that up again is going to be much easier in the winter than it was last spring.
It's wonderful news that you started off with about the mortality rate and how that's dropped significantly. Is it the same people, the comorbidity, that are the most vulnerable to this?
Yes. So we looked at patients that come into the facility with chronic conditions. And if you have one or multiple chronic conditions, you are more susceptible to a more adverse outcome. And the most prominent chronic conditions that seem to be linked with a mortality are kidney disease, hypertension, and diabetes. So when patients come in and have one or several of those comorbidities built into their patient makeup, it makes it a more challenging patient to treat. So, but again, at least we have that knowledge now, which we did not have in the spring.
And is the comorbidity at a certain age, or is it all ages?
The mortality rate tends to skew towards the older population, those that are more prone to a mortality. But I would say that anybody that has one or more of those types of chronic conditions, it will make them a more challenging patient to treat. But the hospitals have done an excellent job of learning on the fly, gaining a greater understanding of what the treatment protocols should be, and implementing them to ultimately drive more favorable outcomes, which is what we're seeing now.
Well, as you said a moment ago, the vaccine can't come fast enough, but in the meantime, I'm so glad you're on top of this. It's very impressive what you've found out. Thank you so much for speaking with us.
Happy to do it.
Sean Hopkins, Senior Vice President at CHART with the New Jersey Hospital Association. Still to come on Jersey Matters, the first COVID-19 vaccination in New Jersey happens at University Hospital in Newark, and the man in charge couldn't be prouder. We talk with Dr. Sharif Elnahal next.